What's the problem? Mediastinal lymph nodes are found in the mediastinum, which is this blue area between the lungs. For patients with lung cancer, the presence of metastases at these nodes significantly affects prognosis. Currently, the nodes are detected on FDG PET-CT scans by a physician, but this is time-consuming and prone to errors. A meta-analysis showed that the sensitivity and specificity of expert node detection are 0.59 and 0.93 respectively. What's the solution? My solution is an automated deep learning-based model that takes as input whole-body PET-CT scans and outputs scans with suspicious regions annotated. An example can be seen here, with the suspicious regions in green and the positive nodes as white crosses. This solution saves time and increases the consistency of nodal categorization. On to the results. As mentioned, there is significant error in the physician's labeling versus a ground truth. We did not have a ground truth, but comparing our model's predictions to the physician's labels on a test set gave a sensitivity of 0.87 and a specificity of 0.94. Because we had no ground truth, a better measure of performance is to compare the variation of results between our model and the physician to that between two physicians. We therefore had the test set labeled by a second physician and again calculated the sensitivity and specificity using the first physician's labels as a ground truth, giving scores of 0.66 and 0.96 respectively. These results, with 95% confidence intervals, are shown on the graph. Can it be adapted to data from a different scanner? We acquired a new cohort of data from a different, newer scanner. A comparison of images from the two scanners is shown on the right. After first fine-tuning the model using transfer learning, on a test set from the second scanner we achieved sensitivity and specificity scores of 0.73 and 0.96 respectively. Thank you for your time. If you want to find out more, come and find me at the booths.
We are going to present Panda Pet Navigators using deep learning. This work was the idea of PhD Lalit Kumar Samar from the Medical University of Vienna. Pacing involuntary head motion can have severe impact on qualitative and quantitative aspects of brain PET imaging. Even in short static imaging, motion can significantly degrade image quality. In PET-CT systems, there is no straightforward and data-driven way to track full head motion that doesn't require additional external devices. Our solution relies on use of conditional generative adversarial networks to generate high-count images from low-count images in low-dose imaging. By doing so, we achieve constant activity distribution over time in all series of PET images from dynamic acquisitions. We train the SIGAN to perform the transformation, and we apply this module to a PET-CT system to register the processed PET images for motion compensation. We validated Panda by deriving first the image-derived input function, and we compared results with and without motion correction, with motion correction based on pre-processed PET frames and Panda PET frames. We achieved less than 1% derivation from the ground truth with our technique. We also tested Panda with 5-second subframes in order to detect intra-frame motion to generate motion-free frame images in dynamic studies. And after motion correction, we obtained images qualitatively superior than no motion-corrected images or registered without a Panda preprocessing. This method is generic and suggests that after being well trained, it could be applied on multiple centers using different acquisition protocols and PET scanners. In the future, we would like to test this capability and expand the use of our method to other types of imaging and motion correction. This work has now been published on JNM. Thank you for your attention.
Hi everyone. Did you know that prostate cancer can give no symptoms for some patients and rapidly grow and threaten life for others? How can we check cancer aggressiveness to act on it? Nowadays, patients may face invasive biopsy, which only provides a partial answer. But visionary doctors may wonder, what if instead we could use medical images to help diagnose and obtain precise disease information non-invasively? Introducing asapC, Automated Segmentation and Assessment of Prostate Cancer, an innovative software suite to extract key disease information from imaging. From quantification to detection and staging, asapC supports clinicians by enabling fast, accurate and reproducible image analysis, powered by artificial intelligence. First, an AI algorithm performs image denoising and partial volume correction of PET images to improve quantification of tracer uptake. Secondly, asapC provides automatic segmentation of the prostate gland and tumor regions from MR and PET scans to delineate regions for assessment of primary tumors. Thirdly, machine learning-based techniques were trained to facilitate reporting and tumor grading by predicting the PIRETS score from MR and the Gleason score from PET-MR images. Explainable AI models will produce attention maps showing the user the image features that inform the prediction. Finally, tumor metastases can be segmented from PET-CT images, allowing a rapid and automated estimation of total tumor burden. Join us at booth 8 for more insights and to have a look under the hood. asapC, the AI software suite in prostate cancer imaging. Because precision medicine cannot wait.
Deep learning-based tools provide astonishing performance in medical image interpretation for diagnosis and classification, but provide little more than a prediction and an accuracy score. They are essentially black boxes that don't really allow explaining of their decision-making process and the causes for unexpected false predictions. In clinical applications and potentially life-saving decisions, it is clear that insight into this black box is required for facilitating trust and adoption of these tools in clinical practice. We are UAI, short for Unrolled AI. We're a small multidisciplinary team with expertise in multimodality medical imaging and artificial intelligence. We want to make AI solutions in medical applications trustworthy, supporting the medical decision process with meaningful evidence and clear decision-making processes. We offer software tools for industry in the field of medical imaging that want to gain insight into their AI-based products and their algorithms' decision-making process. The fundamental idea is to decompose the decision-making process to assess which features are the most relevant and which ones are potentially compromising the overall performance. An expert can then use this information to judge whether the algorithm is providing medically meaningful evidence and reliable results. With UAI, all artificial intelligence solutions employed in clinical routine will be accompanied with medically meaningful insights and a unique view into the algorithm's finding that will facilitate trust and integration in routine medical imaging and clinical pathways.